and welcome to our 2020 Retiree Appreciation Day. My name is Elise Martin. I am with Health Net Federal Services TRICARE Beneficiary Educator for Northern California, and it is my pleasure to be here today to be able to give you this information so that you can be aware of all of the updates and changes available to you for you and your family's healthcare. We're going to start out with some information in regards to your enrollment options. The TRICARE Open season for 2020 this year begins November 9 until December 14. Now, the open enrollment, just basic information, is always mid-November to mid-December, just so that you have that information. During that open season time, if you are enrolled in a program and would like to change, you can go ahead and request a enrollment to a new program, whether TRICARE Prime or TRICARE Select, and that program will be effective 1 January of that following year. Now, there is also the qualifying life events opportunities for you to change your enrollment. The qualifying life events are things, for instance, like change of status, going from active duty to retiree, or going from a single person to a married person, or a newborn, an adoption of a child, a divorce, or a death. Those are qualifying life events, and in those instances, you would have 90 days from that qualifying life event to make a change. Your effective date of that change would be the first date that you became eligible for that change. So though you do have 90 days, I would not wait until that time. I would like to inform you to please make sure to keep the Defense Enrollment Eligibility Reporting System as updated as possible. Those of you who have your DS premium accounts or direct service premium accounts, you can go on to the milconnect.dmdc website so that you can update your demographics. However, if you need to register anyone under your sponsor number, or you need to remove the eligibility for a dependent who is no longer eligible, then you would need to visit the nearest DEERS office. I would encourage you to call the number, the 800-538-9552, to schedule an appointment. With the times regarding this pandemic, most offices are not taking walk-in services or walk-in beneficiaries, and you must make an appointment. That way you can update your information and get your new ID card. Emergency and urgent care. Your emergency, whether a life limb, a issue with a life limb or eyesight, just go to any emergency room. TRICARE will cover an emergency. You do not need to have a authorization to have the care for an emergency instance. I would please encourage you, though, that within 24 hours of having that emergency taken care of, that you call the managing care provider, meaning whether it is Health Net or Humana, or your PCM during business hours. However, you do have the availability of calling the nurse advice line. The nurse advice line at 1-800-TRICARE is available for you and your dependents 24/7, 365 days a year. That number is manned by registered nurses. They can triage your injury or illness. They can also annotate under your sponsor number the problem or issue you and your dependents are having, so that when and if you do need follow-up care, we will have the information in the system. But also, you need to please make sure that you speak to your PCM and advise them once they are open, obviously, because we all know that our urgent issues and emergencies don't necessarily happen within the open business hours between 0700 and 1630. Most emergencies and urgent care happen at 5:01 in the afternoon or evening. The TRICARE Prime program is the HMO type of coverage, and it is available in specific areas. If you live within the Prime service area or the 40-mile radius of the nearest military treatment facility, you can be enrolled in the TRICARE Prime program. Now, the TRICARE Prime program does have some costs involved. I would encourage you to please go to the tricare.mil/costs to see the costs that you would be responsible for. With the TRICARE Prime program, there are no claims to file. Those of you who are enrolled in the TRICARE Prime program have the point of service option for you and your family members. You may seek care from a doctor outside of your PCM's office without an authorization. You would be exercising your POS options. You would have out-of-pocket expenses that do not accrue towards the catastrophic cap for TRICARE beneficiaries. The TRICARE Select program is the preferred provider option or PPO type of plan, which gives you the freedom of choice to be seen by any in or out of network provider, though you do have lower costs when you see in-network providers. Co-payments, cost shares, and yearly deductibles do apply. Again, I would encourage you to go to tricare.mil/costs for updated cost information. With regards to the TRICARE Select program, starting January 1st, Group A beneficiaries will have an enrollment cost that they will be paying. For an individual plan, meaning one person, it is going to be $12.50 per month or $150 annually. The reason I am going through these costs for the Select program only is because this is a change coming for those Select A beneficiaries on January 1st of 2021. The catastrophic cap for Group A beneficiaries will increase from $3,000 to $3,500. And what does that mean? That means that in a calendar year, the most that you will pay out of pocket while covered under the TRICARE Select program will be $3,500. Once that catastrophic cap has been met, then the TRICARE program will pay at 100%. Enrollment fees are waived if you are a medically retired beneficiary. So if you were medically retired, you will not be paying the enrollment costs. There are others whose fees are going to be waived, but I do not believe that they would be involved in this type of presentation, as this presentation is mostly for those who are retired. You must take action before December 14, 2020, in order to designate the manner in which you want to pay for your new medical plan. You can either do the allotment where it is removed from or is deducted from your retirement pay. You can do electronic funds transfer where it is taken out of your checking account or savings account, or you can do a recurring credit card where it is charged to your recurring credit card or that one credit card. However, I would like to please guide you to the allotment program, as that program is the easiest to enroll into. And once you are enrolled into that program, if you have no changes from one region to the next, there is nothing further that you need to do. TRICARE and other health insurance. The other health insurances available in the commercial sector are very friendly with the TRICARE program. However, I'd like to guide you with regards to the Kaiser plan. They don't work very well together. So if you do have TRICARE and Kaiser, you can be seen at the military treatment facility. But if the MTF sends you off base to be seen by a civilian provider, even if the MTF sends you with a referral and an authorization and you have Kaiser, you must go back to the Kaiser plan or must go back to the Kaiser facility. However, if you have any of the other insurances, Blue Cross, Blue Shield, Health Net, Humana, any of those other commercial policies, they can work together with your TRICARE plan. Your other health insurance would always be primary, and your TRICARE would be your secondary or supplemental plan. You also have the pharmacy program. You can still pick up your medications at the nearest military treatment facility that does have the medications available at zero out-of-pocket costs, even if you are not assigned to that MTF. Or you can pick up your medications from the retail network pharmacies. However, I'd like to caution you against CVS and Target-based CVSs or Target-based pharmacies, which are now CVSs. They are no longer in the network and will charge you the full price of the medication. Otherwise, if you do visit a retail network pharmacy within the network, they will only charge you the copay. If you are taking a maintenance medication, we'd like to strongly suggest to you the pharmacy home delivery program, which will deliver a 90-day supply to your home every 75 to 85 days for the next 12 months, and they will take care of all of the refills for you. The copay is as follow on the slide that we are showing presently. The dental options for our retirees is now being offered through the Federal Employees Dental and Vision Insurance Plan. The Office of Personnel Management is offering you the program for our eligible beneficiaries. Please, I encourage you to visit the benefits.com website. There are 10 different companies offering you 2 different plans each. You will have to visit the site to get a quote, as they give you their quotes dependent on where you live or your zip code, and they can give you more plan and enrollment information at that site. There's also the vision option offered by the Federal Employees Dental and Vision Plan. The TRICARE program as a whole does cover your vision. As a retiree, you can get 1 vision exam once every 2 years, unless otherwise indicated for health issues, meaning if you need a visit more often, you will need an authorization. However, through the FedVip Vision Options Plan, you can enroll into one of their 4 companies who are offering you the vision plan, and you can have your vision examined once every year, but also have your glasses and contacts as a covered benefit through this plan. Visit benefits.com for eligibility plan and enrollment information. And again, you can find the different companies, the 4 different companies who are offering you 2 different plans each for those options. I would like to say thank you. This is some information with regards to contact, but I would like to say thank you again for your service. I really do appreciate being here and being able to give you this information. If you do have any questions, please make sure that you call the 844-866-9378 number for the West Region, or 800-444-5445 for the East Region. It has been my pleasure. Have a wonderful day. Thank you.